The Department of Health has been working round the clock to ensure the health of the victims of Typhoon Yolanda are safeguarded from any diseases. Given the magnitude of the numbers of victims, the DOH mission is full of challenges. They have responded to the call of duty of serving our people. The global community has also responded to the call of help. Their numbers are growing by the day. They have shown great compassion to relieve the anguish and agony of our people. And joining us tonight on NewsLife is Health Undersecretary Teodoro Herbosa. Good evening, sir, and welcome to NewsLife.
Good evening. Good evening to all the watchers of NewsLife.
Sir, can you give us an update on the massive deployment of the DOH of its medical staff in typhoon-stricken areas?
We already had pre-positioned some medical teams, and the first team to arrive actually in Tacloban was our team from Albay, which is composed of about 30+ medical personnel and about 20 vehicles. And they arrived there Sunday, and they had difficulty because there's no power, no water. And the second team that went in there was our team from the National Capital Region, a composite team from different hospitals, East Avenue, Quirino, National Children's, of about 55 personnel of varying specialties. And they have now taken over the Eastern Visayas Regional Medical Center, which is today the remaining functional hospital in the city of Tacloban. During the duration of the typhoon and the aftermath, it continued to function contrary to other institutions. The hospital personnel continued to treat their colleagues from Leyte, and they did not go home. The doctors, the nurses continued to treat overflowing injured at that time. And so when our teams arrived, they have relieved them of their, to be able to attend to their families as well and their homes that have been damaged. So it's a real congratulations and kudos to our medical personnel at the Eastern Visayas Regional Medical Center who provided continuous medical care and hospital operations in the immediate aftermath of the impact of Yolanda.
So you've been on the ground. Could you give us an idea of what the are like? What are the obstacles and issues that are being, what are the challenges being faced by DOH personnel?
It's very difficult. Our generator sets are temporary generator sets. They are good only for about 8 hours, or else they will overheat and we will no longer have power. We have very little water, and as you know, a hospital cannot operate without water. So we are requesting for disposable surgical wound kits or trauma kits that can be disposed thereafter, so that we can treat all the patients who have several injuries since the time of the impact of the storm. So we are trying to treat still injuries. Also, because of the lack of potable water, we have sent a public health team which was deployed this morning by bus. And this is composed of a composite team of people that will do sanitation, put up latrines, put up water filtration, so that potable water can be available to the communities that were affected.
Sir, you mentioned only one hospital remains operational. Is that enough? How about the other hospitals in the area? Can they still be used?
The initial report was some of the private hospitals were initially operating for about a couple of days. By Sunday, they had all closed down, or they had become tired and gone home to attend to all their personal duties as well, because their families had also become victims. So those other hospitals have closed down. The Leyte Provincial Hospital in Palo has closed down. The Remedios T. Romales, I think, has the structures are sufficient with some broken glass, and we feel that our next team, it's about a composite team of 200, which will ride those buses that was shown earlier, will be deployed and hopefully will operationalize some of those existing private hospitals, which the owners have gladly lent to us to be able to service the people of Tacloban, Leyte.
So we just mentioned Tacloban. How about the other areas which were devastated by the typhoon? Have you already been to those areas, or are you having a hard time going to these areas?
Our teams have been reporting that most of the Eastern Visayas, including Gilian, is badly hit, Ormoc also. So we are sending teams to Gilian. For example, in Gilian, I have deployed a German medical team, which have been here since Saturday, trying to get a ride on our C-130s. So I don't know if they have arrived already, but that's deployed to Gilian. And then we have sent Belgian team to the north of Cebu, the Medellin and the Daan Bantayan area. We are also trying to reach the other parts, Bantayan Island, which is reported to be also badly hit. And then our regional director, Director Convocar at Western Visayas, is telling us that they can handle northern Panay. So we are supporting her from operations from Rojas and Iloilo.
So
however, Coron is asking for help, Coron and Busuanga. So we sent a team by private plane from Clark this morning together with supplies through the Roro out of Batangas port so that the hospital can operate in Culyon. Half of the roof of Culyon Hospital was blown away.
So is the private sector also coordinating with the DOH in terms of private doctors volunteering their services? What is the coordination like?
Correct. Several of the organizations have actually volunteered in our command conference last Sunday. The people from the PCP, Philippine College of Physicians, actually were represented to look at how they can help. On Monday, the PMA said they would dispatch a boat complete with ambulance, with nurses and doctors. And I think this is scheduled for November 18, and they're organizing this team. It's mostly private sector that will sail to Tacloban to also assist in the medical assistance. So the outpouring of assistance of the private sector and the international community has been tremendous, and we actually would like to thank both the private sector and the international teams that have come here quickly.
So we are getting a lot of help. Now, what is the most common cases now which you are dealing with after 5 days? Are there any signs of a disease outbreak, and what is the best way to keep our people healthy?
As of now, the reported diseases that they are taking care of are still the injuries, and most of them are the wounds that have been neglected since the time they were injured during the impact. However, there are now also reports of course, because of the lack of potable water, some diarrhea in some children. So this is worrisome because some of our medical teams have seen some dehydrated children from severe diarrhea. So we hope that our medical supplies, some of which are still stuck in Cebu, may be flown immediately to Tacloban so that we can use this for those that are having diarrheal disease from lack of potable water. We also ask for assistance to provide water filtration machine. So we will we have one there already, and we've asked the one that responded to our call is actually the Spanish government, who will be sending a water filtration system to provide potable water for the citizens of Tacloban.
So in terms of logistics, we are getting a lot of help internationally and even locally. Is there a problem moving medical personnel and supplies in any calamity-stricken areas? And what kind of support are you getting from our people?
Yes, that is the reason why the President has appointed Secretary Abaya to take charge in the movement of vital supplies. As I told you, we were able to penetrate Tacloban by land. We've been unsuccessful by air. We had to go there by private helicopter or commercial flights when it was resumed. So it's really a challenge. What we're doing now is we've set up a second station in Calbayog and Catbalogan so that our supply chain will be continuous to supply our teams that are going by airplane to Tacloban. So we're trying to suit a supply chain from Luzon that can cross over to Samar and then to Leyte through San Juanico Bridge, so that there will be continuous supply of gasoline for the generator sets, for all the other supplies, food and medicines and other disposable items that are used in the treatment of patients.
Sir, and finally, what else do we need in terms of help so that we can actually get all these things to far-flung areas, those severely damaged?
I think we can only surmise that we need more supplies based on what we're seeing. The hospitals having been non-functional and only a few are functional, they are overworked and overwhelmed. That's why we have some mobile hospital tents that are set up. We have one from Tagum that is set up also in Leyte, and we plan to actually dispatch half of that team from Tagum Davao Regional Hospital also to Ormoc. And we have a Japanese International Cooperation Agency team that's now in Baybay, and tomorrow we'll go to either Ormoc or Tacloban to augment the medical teams that are already there.
Okay, on that note, thank you very much for joining us here tonight at NewsLive. That was Secretary Ted Herbosa. Thank you, sir.
Thank you.